Kalame and Mary Tinker. I'll move back so you can move in.
Good morning, folks. Should I start? I'm Donna Kalame, and I've been involved for a long time with the Public Authority in San Francisco. As Lauren referred to, San Francisco was the third public authority established, but we were the first independent public authority. And, now that we're up and running, that doesn't necessarily mean that people are going to be able to change in their other counties. But it does mean that in San Francisco, as we thought through the way to establish a public authority in order to achieve the vision, we thought an independent board would make sense because IHSS is so important and so complicated that we didn't think our Board of Supervisors would pay enough attention to it. So in the interest of time, I don't want to spend a lot of time, and I've brought some materials that if people are interested, they can look through and get some more detail. But as has also been pointed out, counties really differ a lot from one another in their culture and the size, and that will have an impact on your public authority's work. Just to give you an idea, in San Francisco, San Francisco is a city of about 800,000 people. At the moment, we serve more than 20,000, I think it's approaching 22,000 people on IHSS, with a workforce that exceeds 18,000 people. So it's a big program. I've been there, I helped establish it, and I've been the executive director from the beginning. In 1995, 96, we got up and running. So the structure of our public authority, well, first let me back up and say, I do think it is important to have as wide a support of your Public Authority Advisory Committee or governing body as possible. In San Francisco, with public authorities being, as Lauren said at the beginning, they're such odd entities, it's like people didn't understand what they were. But we had a stakeholder group that included consumers, workers, the county, coming up with the idea of how this public authority could work and run. And we've had continuous support from that stakeholder group. It continues to this day, the IHSS task force in San Francisco. So not only our governing body, but this larger kind of support group of stakeholders especially can get into budget support, budget fights, advocacy for what IHSS is and why it's so crucial to people. We are fortunate in San Francisco that once you got over the hump of people understanding that when you speak about a public authority, it wasn't about nursing facilities, it was about home care. San Francisco has been a very supportive county around the public authority, and I do realize that certainly, as Chris was saying, makes a huge difference if you have support from your county department and so on. So we are fortunate there in San Francisco to have that. But it's been important all along in the history of our public authority, being an independent group. The structure of our board is very important. We obviously do have the majority of people who've either used personal assistance services or in the past or are currently on use personal assistance, not necessarily IHSS, but personal assistance. But then we've also involved mayoral appointees. Right now, the president of San Francisco's Department of Public Health is on our board. The president of the Department on Aging and Adult Services, which is our contracting agency, is on our board. A representative from the Department of Human Services is on our board. These are all mayoral appointees. And on the Mayor's Disability Council, we have a representative. And to me, that's been very significant for us in San Francisco because then even in your board meetings, you're already having some discussion with people who are in the official functioning of the city. And, for example, with public health, when we got our health coverage going, it was very important to have a person on the board that understood how we were going to provide health care to the home care workers. So with that, I'll kind of close, but say I did bring some newsletters that are on the table back there. I'm fully aware that they are stale. They're old. But I think they would give you an idea, if you want to look into it, of some of the activities that we've had over the years. A conference, a forum on the importance of human and civil rights for people with disabilities that drew people from around the state. And then before the current cuts were established, we sent out a questionnaire to all of our consumers, and we got a response from 4,700 people talking about what the impact of the cuts would be in their lives, and we've been able to advocate with that. So with that, I'll close off. Covered both the significance and examples.
Yeah, and I'm Mary Tinker, and I'm the director for the Public Authority in Santa Clara County. And like Donna, I've been involved with the Public Authority pretty much since its inception in Santa Clara. And as Janie alluded to earlier, our Public Authority was established before it was mandated, because here in Santa Clara County, that was a need that was addressed early. They realized it needed to be done, and our Board of Supervisors was supportive in setting that up. And how that is sort of a critical thing for the folks in this room is that I know that in a lot of instances, when public authorities were first set up, and especially once it was mandated, there was a lot of pushback from some of the counties, and there were a lot of county staff who really felt like we were treading on their territory, and they weren't going to like it. And so what it has done in a lot of areas is made it very difficult to be able to advocate and to be able to provide the mandated functions of the advisory committee. And so one of the things that is important in Santa Clara County in the beginning was being able to get past the folks who were concerned at the county, because part of having a good advisory committee or governing body in IHSS is to be taken seriously at the Board of Supervisors level. And it doesn't come instantly. It's a relationship that has to be built. Here in Santa Clara County, one of the things that in the Public Authority and the Advisory Committee working collaboratively together is that we've been able to establish a really strong working relationship with the county staff. There's a certain amount of trust that has to be built, and we've been able to do that. And because we've been able to do that, because we've been able to get the Board of Supervisors and their aides to take our advisory committee seriously when we do the annual report every year. Our advisory board actually presents that to the Board of Supervisors. That's time set aside specifically to hear from the advisory committee on what has been done in the previous year. It's been very valuable because we've been able to actually get a lot of programs put in place, a lot of enhancements to IHSS in Santa Clara County because of the recommendations from the advisory board. That would never have happened if they weren't taken seriously. It would never have happened if there wasn't a strong relationship between the public authority, the advisory committee, and being able to build those strong relationships here locally at the county level. So before changes happen in IHSS here in Santa Clara County, they seek out, information from the advisory committee. What does it mean to them? What are their thoughts and opinions on that? And to me, that's a critical component for any advisory committee or governing body in IHSS. You have specific mandates, and to do it at the county level, you need to make sure that you've got strong relationships. And I am told that our time is up, so we're